Hi, my name is Emmeline Kelly. Together with Jasmine Roush, we will be presenting the case study in health policy and advocacy, practice to full extent. The case study presented in Chapter 7 illustrates the successful transformation of a physician-managed clinic into a nationally recognized patient-centered medical home. The initiative was under the leadership of Master's Prepared Nurse and also 4 advanced practice registered nurses who used the patient-centered care model, the transform model, and also the chronic care model. The success of the transformation can be attributed to Kansas State's regulation authorizing advanced practice registered nurses to practice independently with full accountability to develop and manage medical care plans for their patients and patients' families. Kansas regulation does not require the immediate and physical presence of a physician when care is given by APRNs. The medical plan of care developed by the APRN is based upon an annually reviewed collaborative practice agreement developed jointly by the APRN and one or more physicians. The case took place in a small town of Wyandotte County in Kansas. This town is considered one of the poorest counties in the state of Kansas, with high unemployment rate as high as 10.3% and a high number of uninsured people less than 65 years old. It is federally recognized as low-income population, health professional shortage area, and also a state-designated medically underserved area. The Silver City Health Center is the health care center that provided health care services to the Wyandotte community members. SCHC is a private physician's practice managed for 9 years by a school of medicine as a residency program training site. Since it is mainly a residency training site, the clinic was staffed primarily by non-professional and 1 part-time registered nurse. Based on the information gathered from the community members, the services provided in this clinic were disappointing. In 2006, the management of clinic was transferred to Kansas University Health Partners, the faculty practice plan for the School of Nursing and Health Professions. SCHC became the only academically affiliated nurse-run safety net clinic in Kansas. The leadership changed to a master's prepared clinical director and 4 family practice and 1 pediatric advanced practice registered nurses. The advanced practice registered nurses in Kansas have the authority to make the independent and medical decision about the needs of families and patients. After identifying the clinic's opportunities for improvement, the nurse leaders went to work and developed a foundation based on the patient-centered and the American Academy of Family Physicians transformed model. Using the 8 domains of SCHC care model, all staff members contributed to creating examples of how each domain could help with the quality improvement. The transformation did not come easy as it became the basis for a difficult culture change within the SCHC. The old way of doing business was changed for the better. The discussion on providing quality and safety led to a team decision to move to a new facility that would provide a better accommodation for high quality and patient-centered care. The models enable the nurse leaders and health center staff to learn and implement change and place the patient at the center of the healthcare. The nurse leaders realized that in order to establish a successful patient-centered medical home, they have to start their focus in building relationships, beginning with the internal team. This was accomplished by fostering open communication, strong vision for change, and relentless follow-through to lead the team towards success. The leaders also recognized that the relationship with the community of Argentine needed to be repaired and nurtured. The team began by actively participating in community activities and assessing community needs. After understanding these needs, the team engaged in a process called empanelment. Since the population served by SCHC is ethnically and racially diverse with numerous social determinants of health, a patient acuity rubric was used to assist in establishing patient group sizes for each care delivery team. Policies were reviewed, revised, and adjusted to assist in providing clear expectations among staff and providers. An ongoing review was conducted in order to monitor progress and identify concerns related to patient and care teams' interactions. These nurse leaders understand that building efficient business structures and providing greater access to care must be based on scientific evidence. Therefore, the team engaged in measuring and benchmarking the care they offered. They implemented a chronic disease registry that allowed them to review the outcomes of the care provided. In addition, the team also measured patients' interaction and experiences through surveys, point of care data collection, patient and family walkthroughs. Although there has been great progress, the team recognized that in order to be a full patient-centered organization, the focus on improving the access to care and reducing care fragmentation were warranted. The nurse leaders ensured that the patients have 24/7 access and made sure the patient preferences regarding clinic hours were included. To address the lack of health insurance among immigrants, the nurse leaders made arrangement with the state agency to provide a representative that will be able to answer questions regarding public insurance eligibility for immigrants and their children. Another area that the team focused on to create a truly patient-centered organization was reducing fragmentation. Through collaboration and agreements with community agencies, SCHC was able to facilitate referrals to specialty providers and respond to social service needs. To further facilitate information transfer, the health clinic implemented an e-referral system that made important health data available to specialty providers during the time of patient's visit. In addition, a process for communicating test results and care plans to patients and families was also developed and implemented. The nurse leaders developed a close relationship with a local hospital that allowed them to complete a follow-up care a few days after their patient's hospitalization. In early 2011, Silver City Health Center was recognized by the National Committee for Quality Assurance as a Level 3 patient-centered medical home. This is the first public or private clinic in Kansas to achieve this designation. The success of this case study illustrates the importance of advanced practice registered nurses and their impact on policy change and implementation of policy. Furthermore, as we continue with our roles as DNP nurses, it is our responsibility to understand the tenets of policy and actively participate in policy making at all levels. We have come up with 4 discussion topics. What can you do in your own practice environment to improve access to health care? Include discussions of your organization's current practices and procedures. How can you leverage a sound information infrastructure such as EMR in improving access to care? Do your organization's goals and vision include explicit language about becoming patient-centered model home? How might putting patients and families on your improvement team help achieve success in transformation?